Thank you very much for inviting me. I appreciate that. It's a great honor to give a 30-minute talk at this nice conference. So my name is Heungjae. Um, that's a bit off the title, but I will talk about the application of using electromagnetic waves to detect some biological signals in human body without um, any invasive method. So this talk is about blood glucose monitoring techniques. I'll start the presentation by giving a brief introduction about my project for the last 5-6 years and for the next 2.5 years, and give a little bit of review of what's available, what has been developed, and what has gone through commercial stages, and what is going up currently, and start to talk about microwave sensors and how it works and what it looks like and how it performs through which is verified through a couple of stages of clinical trials. I'll share the results and a bit of summary and future work, which is still a long way to go, but we'll see. So this project was originally funded by the Wellcome Trust, a big medical trust in the UK, under the title of Non-Invasive Blood Glucose Meters. So it's a collaboration between Cardiff University and Swansea University. So at Cardiff University, me and my boss, Professor Adrian Porch, worked on sensor development and tests, and Professor Stephen Lucio, who is the professor in School of Medicine in Swansea University, helped us going through MHRA approval, which is essential requirement for before clinical trial. And he also helped us running how to run and how to analyze data through the clinical trial. And then I recently started a research fellowship, which is funded by the Welsh government for 3 years. It has already been 6 months, under the fancy title of the Holy Grail of Diabetes Management, Bloodless, Painless, Accurate Microwave Continuous Blood Glucose Monitor. It's about filling the gap between the late or relatively late stage of research and early stage commercialization. So it's about de-risking the performance and adding more additive sensors to help improve the performance. And at the end, hopefully, there will be some commercialization outcome of this project. So that's where the Wales is. Cardiff is located, southwest of United Kingdom. And this fund is coming from the European Regional Development Fund through Welsh government. Okay, so in 2015, more than 500,000 kids under 14 were diagnosed type 1 diabetes. And also in adults, 1 in 11 adults in 2005 were diagnosed diabetes, which was in total about 415 million people. And 1 in 2 people were undiagnosed with diabetes, were undiagnosed. So still this number can be much higher actually. By 2040, it is estimated to increase to 1 in 10 adults now. So it is the diabetes population is rapidly rising. And in 2015, 5 million deaths were related to diabetes-related complications, not direct death of diabetes. And it accounts for like 1 in every 6 seconds. It's quite serious. And also, so between 2015 and 40, the number of diabetes cases are rapidly rising to almost 50% rise. And also the spending on diabetes-related management, so healthcare expenditure is also expected to rise. And in the US, $670 billion were spent on health expenditure, which accounts for the 12% of the total spending. And in the case of United Kingdom, by 2035, the diabetes-related direct and indirect cost is expected to take about 17% of National Health Services budget. So it's quite a big issue. And so to avoid this expenditure, if we have a way of measuring your blood glucose level yourself, then you might be able to reduce the number of visits to local GPs and hospitals to measure blood glucose levels and things like that. So self monitoring is essential requirement to ease this kind of rapid rise and reduce the burden, although it's not burden, but reduce the burden on health expenditure. So you can measure. So there are many ways measuring. You can measure many ways that you can measure blood glucose levels. So if we categorize into big two categories: invasive direct method and non-invasive direct method. So easier way. So you get your blood sample, prick your finger, or get blood from your veins and measure it through a device. Or you can get measure from the interstitial fluid, which is the fluid between your flowing through your cells, and you can access the interstitial fluid, or you can measure non-invasively through saliva, tear, urine, sweat, breath. So every kind of liquid you can get without going through your skin. But there is some issue, and it's quite a critical issue. So there's a called dispersion delay. So there are two types of glucose levels of glucose concentration. One is plasma glucose, which is the glucose concentration inside blood vessel, and another is interstitial fluid glucose level, which is the glucose concentration in the interstitial fluid, which is a delayed version of your blood glucose level. And the delay varies between person to person, and even for a single person, I heard that it sometimes changes. When they use this kind of subcutaneous sensor, they sometimes get different delays day by day. So it's between 5 minutes. Sometimes it goes up to, in the worst case, goes up to 45, 50 minutes. It's quite long and critical, especially if a subject has type 1 diabetes and it may not be able to monitor your real-time glucose level through the interstitial fluid glucose concentration, although they use a very, very smart or machine learned algorithms to account for this delay. Still, it's not the direct measurement. So if you now, because you know the dispersion delay, so again, by directly accessing blood, you get a plasma glucose concentration, which is the current glucose level. And through interstitial fluid, although it's convenient because you can make something sitting on your skin and measure it over a continuous level over time, but there is some delay you have to take account. And saliva, tear, urine, sweat, breath, all of them has extra dispersion delay, or the concentration itself is like about 1/10 or even lower than the plasma glucose. So the detection or sensitivity will be an issue when designing these devices or based on these liquids. Glucose monitoring, so you can discretely measure your blood glucose level by pricking your fingers, or you can continuously measure your fluctuation of glucose levels through intravascular method, but not practical. So you use subcutaneous. You have your flexible needle sitting under your skin, and you continuously measure the interstitial fluid levels, glucose concentration. So why do you have to go through continuous glucose monitoring? So these four orange dots show your discrete measurement of your blood glucose level over 24 hours, and the blue background area is the glucose concentration range where you have to stay in the normal range. And if you only measure these 4 points per day, then you might think you are in a safe target zone. So you might think you are healthy, but you miss all these hypo and hyper glycemia events, which is important. And the reason we are monitoring or measuring this glucose concentration is to minimize this dwelling time outside the normal zone. If you do that, you only do that, then you miss all the important events. You might miss all the important events. So so all the commercial technology is now moving forward the continuous monitoring, and there are already devices available. Why non-invasive? I don't have to explain that. That photo is from the Freestyle Libre, which is very well selling in the UK and some parts of the world. So you have this little nice, about 2 pound coin sized device. It's on your skin. It has a small, about 5 millimeters or less, flexible needle goes into your skin, but it doesn't show you how to insert this. They don't show you how to insert this device. It has this, because the needle is flexible, like polyamide based, so you have to have a guide needle, which looks like very scary. And sometimes the sensor just falls off. That's another adhesive issue, and then it lasts up to 2 weeks, so you have to replace positions or locations. So still, yeah, many issues, and also it's partially invasive but still invasive, so you have to worry about infections and other things, the scary factors. So commercially adopted techniques is enzyme-based electrochemical sensors using current generated by the glucose oxidase response when the which is shown in the next slides. And that mechanism was first discovered in inorganic chemistry laboratory in Oxford University by Professor Alan Hill, Tony Cass, and Graham Davis. They have this flag. If you have a time, if you have a chance to go to London after this conference, go to Oxford University, find the inorganic chemistry lab, and they have this flag outside the building. So this golden standard method measuring glucose concentration in the laboratory environment is using this Yellow Springs instrument 2300 glucose and lactate analyzer. That's the reference method you always use, which is based on this enzyme reaction. So when the glucose is oxidase, you produce hydrogen peroxide, and when hydrogen peroxide meets platinum anode, it generates current or electron current. So you're measuring this current, which is proportional to hydrogen peroxide, which is proportional to the glucose concentration. So they are isocategorized roughly into 3 categories: invasive, partially invasive, non-invasive. So the most common way is to prick your finger with a lancet needle and get a blood sample, squeeze it, and feed it into those test strips and feed it into the machine, and they give you the reading after 10, 30 seconds. So these are the list of major companies, and I might have forgotten some of them. There are still many more of them, but these are the ones you normally see on TVs or newspapers. And so that's a discrete measurement. And for the continuous monitoring, you have this kind of sensor and transmitter sitting on your skin with the flexible needle under your skin. And in some cases, you have feedback, a closed loop system, which is connected to the insulin pump, or just as an open loop system. So you just read the value and just activate your insulin pump based on your reading. Currently, Freestyle Libre from Abbott Technologies, that they are doing really well in the UK, and they recently got approved by FDA as a first continuous monitoring device, not requiring any blood draw for calibration. And so what you do is they accumulate data over time, and every time you want to know the blood glucose level, you just bring your reader device to just above the sensor, and it gives you the current reading, including the previous history data. So it's very handy, and although they use the same technology, they they marketed it under the flash glucose monitoring because you just bring your device to the sensor, and I think that changes people's perception, and also it doesn't require a fingerprint test for calibration, so that I think that's a big change. Another similar technology or kind of similar technology is Sensionics. They have this implantable device based on the same enzyme reaction. Um, and when they meet glucose, it generates more flash of light. And this device sits on your skin and it measures through the skin the light emitted by this device. And this sits under your skin. They originally claimed up to 6 months, but it's been approved by FDA, submitted to FDA and under review, and they now claim 3 months of lifetime. But you need a surgical operation to insert this device, and you might have to change position, so it's quite an invasive way. Noviosense is another company who has this. It's quite big, but it's really small, about a few millimeters length, long, and you just insert it into your eye, under your eyelid, and stays there measuring your tears, glucose in your tears. But again, dispersion delay, so it will be helpful for in general showing your general trend over long period of time or early stage detection, but not practical for type 1 or type 2 subjects with very rapid rise or rapid decrease of glucose concentration. Another technology is using this like watch type, Nemora Medical. So they used to have this watch type device which uses a microneedle to extract blood glucose, interstitial fluid glucose from through skin. But they had some issue with the skin irritation due to the microneedles. And there are people with very, very sensitive skin, so quite limited. And they gone quiet for a couple of years, and then they came back with this nice little PET type sensor. Still the same company, but under the name of Shugabi, which also uses the same microneedle technology, and it has transmitter, I think, on the PET. Integrated solutions, they have this ear clip type non-invasive. So it's purely non-invasive, but the accuracy is quite limited at the moment. Another company now under development is GroupWise, which uses about 60 gigahertz range reflection measurement or transmission measurement. But that's just a mock-up device, and they are still working on this big benchtop analyzer. There was some news about glucose and skin patches. They are just at the research stage, and also the dispersion delay is an issue for them. The microwave sensor, I'm not doing anything complicated because what the people want is something simple working. So we are just using split ring resonators coupled by electric field and 2 rings. So one ring is closer to the skin, another ring is further away from the skin. So you will have 2 resonance so it's a slightly different size. So the ring closer to the skin, it reacts this resonant phase, and that it reacts to the change in dielectric properties around the ring. And the second ring is not sensitive to the change in properties, so it stays the same. So you can use the second peak as a reference ring to calibrate outer temperature effect, because everything is temperature dependent in microwave or permittivities. And we use, so that's a step change from air to skin, and we monitor the change within this loaded case. So we get resonant parameters. So I've done some simple COMSOL simulation based on the data available through literature. And what we think is that at this frequency level, penetration depth is deep enough to go through a few layers of skin and fat and muscle. So we think it's directly interacting with blood, but still, and then that field level is quite exaggerated. It's a simulation to show the concept, but we think we are interacting directly with blood, and it will be supported by the data. So made it more round, the same 2 rings and PTFE holding structure around it. same two rings and a thermistor inside. So it's connected by the RF cables, and it's connected to the skin through 3M double-sided adhesive tape, which is medically safe. Data rate is about 1 point per 2 seconds. Or it's already too much information for the glucose change because the time frame is about glucose rises over 30 minutes, 1 hour, 2 hours, goes up and down. So quite a lot for that. Then so currently we use the portable network analyzer to measure the resonance characteristic and measure temperature. So we made this to put everything on the trolley and put it on clinical trial. So what we do is we do frequency sweep, then curve fit to get the resonance parameters like resonance frequency, 3dB bandwidth, and insertion loss, and the Q factor as well. And then we apply temperature correction because again everything is temperature dependent, and then do average because we get much more data than the reference blood glucose level. So we do so average over time and use that to compare with the reference blood glucose. And then convert this microwave data into blood glucose level. At this stage, we need some reference slope just to convert this number into blood glucose. So we use the reference blood measurement to convert. So we might need some better idea in the future to get rid of this blood measurement. For doing the clinical trial, you need to get approval. So in the UK, there's a there's an MHRA, which is counterpart of FDA in the UK. So you submit copies of files in the city, and then you pay for £4,000, and they sit on the document for 60 days and give you the letter of no objection. Clinical trials. The trial was done in the Institute of Life Sciences too in Swansea University. They have this nice research facility, and the diabetic subjects and healthy subjects were recruited from the local hospital, the university hospital patients, and they all went through the proper pre-screening and after or post-screening. So it's all done properly through a clinical approval and local ethics approval. And so we have done oral glucose tolerance test, which is you give your glucose drink, very, very disgusting, too sweet glucose drink, and you drink it and you measure it. So you fast it overnight and then you drink this and then you generate this nice peak, and we measure it and compare it with your reference method and the proposed method. So we had 24 subjects, so 8 healthy type 1, 4 type 1s, and 12 type 2s. Blood sampling was done through blood intravenous cannula approximately every 15 minutes, and measured, analyzed by the YSI 2300. So this shows the raw microwave data. So over time, the raw mic. So that's a resonance frequency in this case, which is a kind of a function of a real permittivity, and this shows insertion loss because I'm measuring 2-port S21. So this is the insertion loss of the peak, which is linked to the imaginary permittivity. Because you only have data reference data every 15 minutes, so I just accumulated all the data over 15 minutes and added through the next time slot. So compared with blood. So the red empty circle is the blood glucose concentration measured by YSI, and the blue dot is microwave data with the standard deviation. And it in time domain, so there was a glucose intake at 60 minutes, and it looked quite okay. So that's a good example, as I said. You only show good ones at the conference. So it's plotted the same data in a linear correlation chart. So the linear correlation was about 0.98, and the MARD, which is mean absolute relative difference, is how it shows how far you are away from the reference 45-degree linear correlation line, which is about, in this case of subject, which was 3.18%, and normal electrochemical sensor shows between 10 to 15%. So it was really good, but it's only one subject, which was good one. So for the statistics, you need to collate all the data and plot into many different types of error grids. But in this case, we just use Clarke error grid because that's a typical way to use it. So it's literally practically a linear correlation chart again. So that's the data set from all 24 subjects, which are 255 points of data. And only 4 points falls in zone C, which 1.6%. So which means 98.4% lies within zone A and B, which should be there. The requirement is, I think, 99% of the data should fall within zone A and B in this case, but that's the requirement for the chemical sensors. So MARD of all 24 subjects is about 12.5%. And I used two devices, so there is some device-to-device variation because all the devices were fabricated by myself, so still needs to be improved. So the sources of error, it's absolutely a function of quality of contact, which is a kind of limitation, but can be improved with some assistive different sensors. But in this case, it was a wired sensor, so we had to put it by cable and external pressure. We could press the sensor from the top with different density. Also, there was some position dependence in this experiment. We used abdominal area, so there was some blocking by the ribs or some things, and also function of temperature, moisture, which we haven't investigated yet, but there are literatures available about the effects of moisture buildup. Also, you have to go through, if you want to get this CE mark, you have to go through these kind of chemical interference tests and varying hematocrit levels, the effects of blood oxygen levels, and also mechanical vibration and shock EMI and stuff. So again, I don't think we need a summary. So I shared the story, what I have went through for the last 5, 6 years doing this project. So we are currently talking to some commercial companies, and I have some further results after this, which will be released soon. But we are currently talking to companies to commercialize the techniques in the near future. And this was funded by, again, the European Regional Development Fund through West Government. Thank you.